When I first began treating Lyme disease, I adopted an escalation approach. This method involves starting with a standard dose of doxycycline. Typically lasting a month, and then observing how the patient responded. If the symptoms persisted, or if I suspected that a co-infection might be present, I would escalate the treatment, adding or changing medications as needed. This approach was cautious and reactive, focusing on adjusting the treatment plan based on the patient's progress over time. However, through years of experience and patient outcomes, I shifted my strategy to what I now call an early aggressive treatment approach. Rather than waiting to see if symptoms persist or worsen, I take proactive steps right from the start. I start treatment as soon as possible after initial symptom onset to give patients the best chance of minimizing a chronic illness. I maintain a low threshold for switching therapies when there is breakthrough disease activity, like clinical relapses or continued illness. This may help prevent chronic illness. If a patient has an inadequate, that is subtherapeutic treatment response to an antibiotic, I choose another antibiotic with a different mechanism of action. If I suspect a co-infection with Babesia, I start treatment with a tovicone right away. This is crucial because Babesia requires different treatment than Lyme disease and can significantly impact recovery if not addressed early. Similarly, if I suspect Bartonella, another common co-infection, I begin treatment early, even if I haven't confirmed whether the infection was transmitted by a tick or a cat. Bartonella can cause a range of symptoms that complicate Lyme disease, and early intervention can prevent the condition from becoming more severe or chronic. This early aggressive approach represents a significant shift from the more traditional wait-and-see methods. The reasoning behind this shift is rooted in the understanding that Lyme disease and its co-infections can be relentless and complex, with symptoms that vary widely among patients. By addressing potential complications head-on and without delay, I've seen much better patient outcomes, recovery times are often shorter, and the risk of developing chronic symptoms is reduced. Moreover, this approach is not just about quicker recovery, it's also about improving the overall patient experience. Lyme disease can be a devastating condition, both physically and emotionally. The uncertainty and frustration that come with a prolonged illness can take a significant toll on a patient's mental health and quality of life. By being proactive and addressing all possible aspects of the disease early, I can provide my patients with a clearer path to recovery and reduce the likelihood of prolonged suffering. In summary, my move to an early aggressive treatment strategy has been shaped by my commitment to providing the best possible care for my patients. This approach allows me to tackle Lyme disease and its co-infections more effectively, offering patients a better chance of a swift and complete recovery. It's about being proactive, thorough, and responsive to the complex nature of tick-borne illnesses, ensuring that no stone is left unturned in the quest to restore my patients' health.